Hey, good morning, everyone. Thank you for joining. I'm just going to give a minute or two here to let more attendees jump into the webinar, and then we'll kick things off. So we'll just sit tight, and then we'll get started with Lori and I. But for now, just going to, like I said, give a minute or two to let more attendees jump into the webinar. Just going to give it another minute or so, and then we'll get started. Thank you all for jumping in at the top of the hour here. We have a great session planned with Lori presenting, and we'll be kicking off shortly. Just going to give it another minute while more attendees join here. Alrighty, why don't we get started? I'm just going to start off with a couple housekeeping notes. Thank you all for joining our Level Up webinar today. This is the first one of the year for Experian, and we have many more to come. So thanks for joining us for the first webinar of the year. We do want to note that we have muted and turned off everyone's cameras just to eliminate any kind of audio feedback during the presentation. But this is being recorded, and we'll be sending out a copy of that recording and a copy of the deck. So keep a lookout for that after the presentation. So just want to introduce Lori, who is our presenter today. I want to welcome her back. She's presented in the past couple webinars for us here at Experian. She's one of the founding members with over 17 years of experience, and she is our Senior Vice President of Executive Sponsorship. So a little bit about the session. We've used the mantra out with the old, in with the new, which I'm sure many of you have heard this phrase before, but you're probably thinking, what does that actually mean for revenue cycle management? And that's kind of what we're going to cover today. We're lucky to have Lori presenting, and we're going to be reflecting on our past successes and challenges from last year and how we can learn from them, taking all that data, the reporting, and how to navigate for the months to come in 2024. So again, thank you for joining us today. We're super excited, and I'm going to pass this over to Lori to kick us off. Thanks, Lori.
All right. Thanks, Andrew. And thank you all for joining us this morning. So as Andrew said, today we're going to share with you some information that we've gathered on what transpired in healthcare revenue cycle primarily in 2023 from an industry perspective. And we'll also share some of our own findings that we've accumulated from our own data regarding the work that we do in denials and complex claims processing. Then we'll take a look at what we're being told that we can expect for 2024 and some recommendations on how to prepare for what we think is ahead of us. So before we get started, I just want to give you some perspective on where some of our data comes from. Most of you are hopefully familiar with Experian and know that we concentrate on that small percentage of your revenue cycle that's difficult to resolve. Claims that require a higher level of expertise, maybe specialized resources, and possibly even legal support. So for us, that means, the resolution and prevention of denials, underpayments, and aged accounts receivable, as well as, managing complex claims related to motor vehicle accidents, workers' compensation, military payers like the Veterans Affairs Department and TRICARE, and out-of-state Medicaid. So our highly skilled teams are supported by our innovative technology to help us get the highest recovery yield in the shortest time possible for our hospital and our healthcare partners. So just to give you a little perspective, we processed over about 1.6 million revenue integrity claims in 2023. So these included technical and clinical denials, underpayments, and aged AR. And then our MVA, work comp, VA, and OSM teams processed a little over 1 million complex claims last year. We serve over 1,000 client locations nationwide, which includes 5 of the 10 largest health systems in the country. So we've invested over the last several years in technology that allows us to capture and analyze important data related to the processing of these claims. So let's start by looking back at 2023. So I think we started the year with a pretty high level of optimism. So most of us believe that we had the worst of the pandemic behind us. And even though Medicare physician reimbursement continues to be reduced, the rate increase for inpatient ended up being slightly higher than what was initially proposed. We've been seeing, an uptick in our patient volumes that were not COVID related, and we were expecting those trends to continue. Hospital margins were predicted by many in the industry to be back to kind of pre-pandemic levels. We also thought that staffing shortages would improve as COVID-19 subsidies and various, economic protections ended, prompting many people to have to re-enter the workforce. So most hospitals and healthcare systems were already working to improve their performance and increase innovations as they responded to a lot of challenges that we've been dealing with in the industry over the past few years. We also saw a lot of mergers and acquisitions happen, which helped some struggling health systems join forces, with other systems to give them a little bit better stability. Although 2023 proved to be another challenging year in healthcare, hospital margins did improve, but they were only slightly above break even, with many hospitals and health systems at or below break even. Our patient volumes did increase, but they were somewhat hampered by inflation and things like, the Medicaid redeterminations, which prevented some patients from, being able to afford care that, and they ended up putting more procedures off. Our costs increased, which is one of the significant factors that we dealt with, not just for labor, but across all of our expenses. And our staffing shortages continued. We saw a lot of baby boomers exit the workforce, and younger generations, they want less traditional employment. This also continued to increase Medicare enrollment as these older generations retired. Payer constraints and cost control measures continued to drive the shift from inpatient to other care settings. And then payers that were dealing with their own rising expenses and margin pressures and appeared to really increase their efforts to deny or to delay payment. And then one of the most difficult payer types that we are involved with, Medicare Advantage plans, they continue to significantly increase their market share. So let's take a look at some of those statistics for 2023. So hospital margins did improve from the 2022 levels, and the revenue increases did outpace the increases in expenses slightly, which did provide a little financial relief for some hospitals. So we ended the year at an average of about 2%, which was below expectations, but better than some prior years. So our outpatient revenues increased by 12% over the last year and are up about 43% compared to 2020, while inpatient revenue has only increased about 15%. Claim denial rates increased another 12% and are up more than 18% since 2020. Denials related to front-end errors increased 41%, up from only about 10% in 2020, which is probably an impact of a combination of some of the staffing issues that we've encountered, and also that increasing complexity caused by, payer requirements that are continuing to expand. So denials related to medical record documentation increased by another 14%, with about 97% of those being related to missing or invalid documentation. And then one of the more concerning statistics for our healthcare providers is that days cash on hand dropped significantly in 2023. These increasing costs and delays in payment related to denials have definitely impacted the cash on hand metric. So hospitals still received the lion's share of healthcare expenditures last year, although that physician segment is continuing to grow. The increase in outpatient volumes continued. The elimination of one overnight stay cuts overall cost of care dramatically. And there's been so many advances in medical technology and techniques that we've been able to expand the number of procedures that can be done in an outpatient setting. There's also been an expansion of care being able to provide it in-home. So some of these things are impacting where care is being delivered today. So as I mentioned, healthcare margins were impacted by expense increases that outpace revenues and cost savings generated from some of the performance improvements that many of you had already put into place. Staffing shortages were one of the most significant factors. According to the U.S. Chamber of Commerce, there remains a labor shortage in the United States. In January, the report indicated that we have 9.5 million job openings and only 6.5 million in unemployed workers. Because of the competition for these workers, it costs more to attract and retain them, not just in wages, but potential hires want additional benefits and other demands like flexible work schedules and remote work. There also is becoming more of a skills gap in the marketplace for both clinical and revenue cycle employees. And a lot of this is just related to the competition for these skilled workers. This can increase your labor costs because you're having to develop those skill sets internally. Agency and temporary worker utilization was dropping by the end of last year, which did have a positive impact on margins because these tend to be much higher cost resources for our staffing. Now, VMG reported that 77% of health system leaders surveyed expected labor shortages to be one of their most prominent financial challenges in 2024. And so while revenue did increase in 2023, it was lower than it should have been because it just became more difficult to get paid. Denial rates increased substantially, especially in commercial and Medicare Advantage plans. It was estimated that payer denials cost healthcare $1.5 billion each month and contribute to workforce burnout. 15.1% of commercial claims were denied, which was over a 20% increase from 2022, while Medicare Advantage denials increased by 56%. And even though a lot of those, there's an estimated 80% of those denials can be overturned, there's usually a significant number of these claims that don't get submitted or appealed because of staffing issues or lack of expertise. I think one statistic I saw indicated that as many as 60% of denied physician claims are not resubmitted. Patient debt also presented some challenges because inflation impacted the spending power of most households. That plus the increase of high deductible healthcare plans was also becoming more of an issue in 2023. A lot of people take the high deductible plans thinking that you're not going to need really to use healthcare, and then they end up having some type of accident or illness, and then they're not able to take care of those out-of-pocket expenses associated with those high deductible healthcare plans. 2023 was the first year where the majority of patient debt owed to hospitals was with patients who actually were insured. So 75% of our revenue cycle leaders surveyed said denials management consumes the most time for their organization. So payer mix for 2023 continued to be dominated by governmental and commercial insurance, with Medicare and Medicare Advantage plans taking an increasing share. We kind of mentioned a large section of our population is the baby boomers and similar generations that are aging. They're qualifying for retirement, and they're aging into the Medicare system to be eligible for those coverages. And so traditionally, we always, providers like to see a higher percent of commercial insurance in their payer mix because that reimbursement is typically higher. But those plans are becoming more and more difficult to manage. They're engaging in practices that lead to longer processing time and higher denials than traditional government payers. Medical necessity demands for commercial managed care plans increased to 3.2%, where Medicare has remained at only 0.2%. 1 in 3 inpatient claims submitted to commercial insurance weren't paid for over 90 days in 2023. And as I already mentioned, commercial payers denied 15.1% of their claims in 2023 compared to a traditional Medicare that only challenged 3.9%. Requests for information denials for commercial payers were 12 times those of Medicare. And then the substantial increases in both the number of denials for Medicare Advantage and commercial payers is starting to make those payers less desirable. So while Medicare reimbursement is lower, that payment does tend to be more predictable. Why are we seeing such an increase in denials for commercial and commercially managed plans? Well, one reason is that these payers are experiencing the same pressures on margins as hospitals for much the same reasons. Their costs are increasing, their labor costs, they're dealing with their own staffing challenges. So they are looking for more and more efficient ways to identify opportunities to impact payment. The other reason is that it's becoming a little easier for them to identify these potential denials because of technology. They seem to be ahead of providers in their use of technology based on the increase in congressional inquiries and legal actions we're seeing across the country. United Healthcare, Cigna, and Humana have all recently been involved in litigation that alleges that they're using AI tools inappropriately to wrongfully deny claims. So 2 of those cases are alleging that United Healthcare and Humana are using technology that knowingly has a 90% error rate to identify denials, especially when it comes to Medicare Advantage claims. The litigants in the case against Cigna also allege that those denials are generated based on a review of each claim that takes only 1.2 seconds. And another case alleges that Humana disciplines or terminates employees who deviate from their AI model projections. So the issue providing the basis for these and similar cases is that many states have legislation that requires that claims be reviewed by a physician before they can be denied. So while these payers are all aggressively denying these claims, the primary takeaway is that they do have more tools at their disposal to help them identify discrepancies in claim documentation and billing that they can then question. So our data kind of tells a similar story. We are seeing these denial and payment avoidance trends in our own business as placements from our denial clients alone increased more than 28% last year. So ranked in order of volume, medical necessity denials for inpatient versus outpatient increased from 13% in 2020 to 46% in 2023. And these types of denials outnumbered all authorization-based denials combined. The good news is that while many of these types of denials can successfully be overturned, but as we previously mentioned, they take a significant amount of effort. So we achieved a 90% success rate in our day 1 clinical denials, which indicates that a lot of these denials are being denied in error. So payer avoidance is also something that we see in our other service lines, even though many of these involve non-traditional payers such as automobile insurance, workers' comp insurance, and then military payers like Veterans Affairs and VA, and TRICARE. You know, when we try to track these reasons because it really helps us to develop, you know, our own adjustments and process to try to combat some of these delays in reimbursement. The number one reason we have to resubmit a claim is that the payer claims not to have received it. And that's followed by requests for additional documentation or maybe missing or incorrect authorization numbers on claims that were previously submitted by our facilities. We track these reasons so that we can make the necessary adjustments in our own workflow or that of our client to try to eliminate the root causes for these delays if possible. One example is we found that electronic claims for motor vehicle accidents can be particularly problematic because that may not be the payer's preferred method of accepting, that bill. They may be set up with an electronic payer ID, but then when you get to the actual payer, they're really not, those claims aren't coming into someone with any reliability in order for them to process them accurately. So we try to adjust our billing processes to reflect automobile payer preference, whether it's, an electronic submission that they actually want to receive and can process, or maybe the best method is going to be through a secure fax or email. The number one reason that we have to file for reconsideration or appeal across our complex claims continues to be that the payer just processed it incorrectly, meaning it was improperly denied. This is especially true for our Veterans Affairs claims, as the VA often relies on contract labor to manage these volumes of processing, and then they may not be as well trained. The second highest cause of reconsideration or appeal for these types of claims is the need to submit with additional documentation. And a lot of that includes some proof of timely submission for the prior submission that was done by the facility. We just know that it's important to know why your revenue is delayed and which payers deny most often and for what reasons so that you can adjust process internally to try to get the reimbursement faster. It's also important to know why you aren't being paid at all. In traditional complex claims, we find that majority of reasons for no payment are not really clinical type denials, but they're related more to coverage, eligibility and coordination issues. We use our data to identify where we can work with our client to avoid missed opportunities, such as placement delays that lead to coverage being exhausted or may create timely filing issues. We also can determine if a claim should have been identified differently during registration to help offset delays because of, there was another payer that should have been billed initially. And then we can incorporate those findings into some additional training for patient access teams, or even, use different tools to help improve electronic payment placement identification. So now let's take a look at, we've taken a look at kind of what we saw in 2023. So let's change our focus to what we're being told to expect in 2024. So most of the trends that we saw in 2023 are expected to continue. Some of the rating agencies like S&G and other ones are predicting that hospitals and healthcare systems in 2024 will continue to have challenges. Those projections range from a negative view of the industry to stable projections. And a lot of the reasons given for some of these dim outlooks were that labor shortages and costs are expected to continue to be a drain against increasing revenues. Regardless of the publication or the article that you read, almost everything indicates that investments in technology are going to continue to be more and more necessary to mitigate the impacts of staffing challenges, rising costs, and problematic payer behavior. So how do you prepare for these challenges? So fortunately, these are not new conditions that we're dealing with. So most of you have already put in many of these initiatives into place or are planning on doing so in the near term. Healthcare leaders across the industry are focusing on these three critical areas. Technology and automation investment is one, staffing is another, and dealing with payer constraints that delay or deny payment is also a factor that's going to be important for improved financial performance in healthcare. So as I mentioned, a lot of the industry experts are continuing to, focus on technology advancement, things like machine learning, artificial intelligence, automation. These are all topics that we hear a lot about in healthcare, especially in revenue cycle. So the thought is that these advancements and these investments in technology are going to be critical for you to be successful in healthcare in the years to come. One interesting statistic that I came across said that 62% of hospitals did not automate any part of denials management in 2023, but that 78% of them plan to automate some aspect of that by the end of 2024. So automation, machine learning, and artificial intelligence represent a potential arsenal of tools. However, it's crucial to recognize that ultimately tools are just tools. If you really want to generate value, this new technology must be seamlessly integrated into solutions that will effectively address the real problems that, for either your users or your customers. Team members who are using this technology are mostly just concerned with the functionality and how they experience, using that solution, whether it's driven by artificial intelligence or not. So our chief AI officer, Spencer Ali, recently did an interview for Forbes magazine, and some of the recommendations that he gave in answering some of their questions was that, you start by identifying your greatest area of need. Is it to address issues with delivering clinical care or to improve the patient experience? Or is it to reduce costs and address staffing shortages and revenue cycle by employing more automation and RPA, eliminating some of those keystrokes? Or do you need more advanced AI and ML tools to help prevent denials or to understand, more analysis with the data that you're accumulating through your EMRs? Once you've identified your biggest need, you then need to determine if you're in the right position to move forward. For example, are you capturing the data you need to make the solution effective? A lot of artificial intelligence and ML models are going to depend on a great deal of data to come to the conclusions and provide the analysis that they're designed to give. Another tip that that Spencer had was to leverage leaders in the marketplace. They will have insight on what works and what doesn't, as well as some pitfalls to avoid and resources that may be available based on their own experience. Do you know other providers that use your same EMR that have already deployed the technology that you're considering? Sometimes they can provide a great starting point based on their experiences or even the resources that they found to get this technology embedded into their processing. Consider collaborating with a strategic partner. Is the technology you need already available in the marketplace? Is there a business partner out there that's already using it? Does it make more sense to partner with someone who already has it and can be responsible for maintaining it? And do you want the responsibility for making sure that you're adhering to the changing regulatory environment? AI is quickly becoming a concern across multiple industries, giving rise to litigation and the need for regulation. As we've already seen with cases we mentioned earlier involving payers and their use of AI for denials. Depending on your focus, it's usually best to start small and avoid overinvesting in a singular technology. New approaches and innovations are happening really quickly, so you don't want a solution that's already about to be outdated before you get it up and running. Finding resources can be challenging. At Asperian, our team, we use a multiple array of tools from multiple cloud providers and a mix of both self-managed and vendor-managed solutions. And we're constantly experimenting with some new tools and approaches as they become available. Now, if you have questions about how to best utilize technology in your organization, our February webinar is going to be a question and answer type session with Spencer Ali, who, as I mentioned, who is our Chief AI Officer. And I know at the end of this presentation, Andrew's going to give you a little bit of information about how you can submit some questions that you may have if you're looking for just some, practical advice about approaches to using technology in your revenue cycle. So when it comes to technology here at Asperian, we've been investing heavily for the past several years, all with the goal of trying to increase collections and provide meaningful insights back to our clients that can positively impact their organization. So we've developed proprietary systems just to manage the workflows around denials and complex claims. But part of the investment in these systems is also to gather the information we need to understand what is happening both in our internal processing and what's happening on the client side, what's happening upstream on those denials or the claims that we are then receiving and that we're trying to resolve. You really can't fix what you don't know is broken. So a lot of it's going to start with that type of analysis and diagnosis, so you can, where to kind of focus your efforts. So once we started improving our ability to capture the data, we hired data scientists to create ML models to help interpret that data, and are now able to create adjustments in our internal processes and workflows and make recommendations back to our clients that are supported by this data. We've successfully used automation for things like patient engagement, claim statusing, and other workflow accelerations that allow our teams to focus their expertise on what they need to do and the decisions that they need to make to try and obtain more reimbursement for our clients. And we're trying to eliminate some of the redundant tasks and manual keystrokes that are inherent in some of our processes. Improved price accuracy and advanced technologies like utilization of large language models and predictive trend analysis are all areas of focus as we're working to try to help our clients overcome denials and get paid for the service that they're providing. Our focus is not just about resolving them and getting you the right reimbursement, but we're really trying to figure out, how do you prevent the denials to begin with? How do you identify which claims have a better propensity to pay than others, so that you can then identify what's causing that, that breakdown and preventing the ability to get paid for the services that you're already providing. So we've mentioned that staffing challenges are likely to continue. So if you're already encountering difficulties building out your teams, it's important to consider all options. Some of these difficulties may be geographical, depending on where you are, the location that you are, and the resources that may be available there in your proximity. You need to take a good look at your situation and determine, can you attract and retain and develop good talent for your organization? And can you do that at the right cost? Employees today want more. They want more comp, they want more benefits, they want more flexibility, they want a better work-life balance. I mean, some of them want to work 20 hours and be paid for 40. So, can you can you hire the right skill set you need, or do you have to train and develop them internally? And if so, what will that cost? I mean, there's just more competition for those employees in the marketplace that have a desirable skill set. So if you're having to build out some of those skills, what's that going to cost you? Is that something you already have set up and it's part of your normal training process? So there's really no additional cost for you? Or is that something that has to be developed and you're going to have to incur those additional costs? Technology can help. As I mentioned, a lot of automations can alleviate workload and redundancy, eliminating those manual keystrokes. A lot of that technology may be available out in the marketplace. I mean, it does have to be maintained, but there are some solutions that might be, the right one for you. Industry experts recommend that healthcare systems take a good look at what they have, determine what your department or organization is good at, and consider alternatives for the rest. Should you consider outsourcing? Is there a positive ROI for that? Is offshore a possible solution for you? And if so, are those optics worth the savings that could be generated through that? So it's really important that you just, we often hear arguments against the cost of outsourcing or making some of these changes, but you really need to look at it from the view can you afford not to? How much reimbursement is at risk if you don't? Is a temporary solution a viable option while you build out, train, support your internal teams? So those are all considerations that are facing a lot of us today. So when we look at what we experienced in 2023 and how we're preparing for 2024 with regards to staffing, we know that having team members with a high level of expertise is critical for the services that we provide our clients. We had our own issues with attrition as a result of the pandemic, and so we had to make employee retention a key focus in 2023. It's very, costly to try to create that level of expertise that we need with our team members. So what we did is we first looked at what we were paying. We completed market studies, we made adjustments in our compensation, and our job titles. We added an incentive-based comp plan, but we knew that, just paying more wasn't going to be the entire solution. As I said before, employees just want more from their job experience. And so we made, leadership training a focus. You often hear that employees don't leave a job, they may leave a particular supervisor or manager sometimes. So, we wanted to make sure we were equipping our leadership teams with the right tools for success. So that was one focus of our training department. We also wanted to make improvements to our onboarding and our service line training programs. We implemented more flexibility into our work schedules. We expanded our ability to accommodate remote and hybrid work settings. So through a lot of these efforts, we were able to reach our retention goal in 2023, but it took a considerable amount of investment and expense, and it continues to be a key focus for us. When we look at the payer issues we've encountered in 2023 and even before, we do expect to see, that the difficulties we're having in getting paid are likely to continue for 2024. So you really need to be prepared to fight hard for every dollar. I've had more than one client tell us that they feel that they're at war with the payers. And, that's really not something that we're expecting to change in the near future. Others have said, it's kind of like an never-ending game of whack-a-mole. You solve for one issue causing denials, and then another issue will crop up, and the payers, change their focus on another items that they can deny. We know that Medicare Advantage, we mentioned that market share is continuing to increase. And, Medicare Advantage payers have already started off the year by applying coverage criteria that's a lot more restrictive than traditional Medicare. So we need to be prepared. Payers that are using technology to identify those discrepancies in, documentation or in billing, that technology, they're going to continue to utilize that technology. So their ability to identify those issues kind of outpaces our ability to identify them and prevent the denial internally. So you really need to assess the abilities of your team and your organization. Do you have the right tools? If not, can you get them? Do you need help? Do you need a long-term or do you need a temporary solution? Can you free up resources to focus on, your denials and your larger segments of your revenue cycle by outsourcing something that's maybe a less significant piece and it's something that you don't do particularly well. So you really have to look internally just to make those assessments and determine, basically what are you good at and, what should you consider getting off your plate. And when it comes to denials, it's not just about overturning denials and getting paid. It's really a focus about preventing the denials. That's just as important as getting the reimbursement for the services you've already provided, if not more so. So we at Aspirion use a holistic approach to address the denials that we receive for our clients, using our technology to try to identify the denial type and assign it to the appropriate level of expertise that matches up with the complexity of the claim. Is this a situation that really needs to be handled by one of our senior attorneys? Does it need review by, one of our nurse clinicians? Or is it a denial that really it's about the coding? Do we need to have, one of our coders review it? And then, the appeals are assisted with a legal assistant or another resource that we have with experience in that with that particular payer and denial type. We've invested in technology capabilities that, that are infused in our processing with the goal to try to increase speed to resolution and also to identify how do we prevent the denials from occurring with our clients. When we start with a new client, we do try to determine, where do they need assistance? Is their best return going to be from, sending us claims at the point of the initial denial? Or does a discretionary program make more sense for them after they've tried their own internal appeal? Regardless, our goal is to try to identify the trends and provide actionable suggestions to try to prevent these denials from reoccurring while we're working to obtain the reimbursement. We focus our technology on supporting the efforts of our teams, just with the idea that we want to allow them to concentrate on identifying the correct action for resolution instead of spending their time doing, the busy work. We're continuing to look for meaningful ways to expand AI and ML for both successful resolution and prevention of denials. So I know a lot of what I shared with you today about, what's happened in 2023 and kind of the fact that we can expect more of the same in 2024 is a little bit discouraging, but let's kind of end on some positives. So the challenges expected for the coming months, they're not new to healthcare. They're not new to anyone attending this webinar. Most of you have already put improvements in place or made plans for them, or you're aware that this is an area of concern for your organization. Some of the improvements that you already made in the last couple of years really helped to offset the increase in expenses we saw in 2023 and allowed you to end the year with a positive margin. We do expect our patient volumes to continue to increase, especially, we've mentioned that a larger segment of our population, even though they've aged out of the workforce and more of them are entering retirement, just as they age, their need for healthcare is going to continue to increase. So, as a result of this, revenue is expected to continue to increase. And technology is becoming more and more accessible and affordable, and is enabling us to change how healthcare can be delivered to our communities. And some of those methods of delivery, may be more cost effective than what where we've traditionally been providing care in the past. Our hospital associations and lawmakers seem to be paying a little bit more attention regarding some of the issues that we're facing related to, payer avoidance, denial, and delay tactics. And it's just important to know that you're not in this alone. There are business partners with a variety of services to provide help if and when and where you need it. And some, like here at Aspirion, have already developed tools needed to maximize your reimbursements in today's challenging healthcare environment. So with that, I want to just thank you for joining us today. I hope you found some of this information interesting. I know it was very interesting for me as I did a lot of the research to try to put together this look back at 2023 and look ahead to 2024. Or actually, we're already in 2024, so it's just what we're facing in the months to come. And so with that, I'm going to turn this back over to Andrew. Thank you.
Yeah, thank you, Lori. Really appreciate everything you presented today. And I want to thank you all who joined and stayed for the entirety of the session. I know some of you on the West Coast, you're kicking off your day with our webinar today, and some of you might be on the East Coast, so it'll be kind of late morning, early afternoon. But there was a lot to unpack there. I know there's a lot to digest. So I just want to remind you that we'll be sending a recording and a PDF of this deck that was presented today. Also, as you can see on this slide here, I want to note that our next webinar will be presented by our Chief AI Officer, Spencer Ali. He's got a breadth of experience in automation and ML. He'll be sharing some trends and things to look out for in the AI space as it continues to gain traction in the marketplace. So this will be kind of like a Q&A style session that we'll do. And we hope you can join us. This webinar is scheduled for February. So look out for an email with an invitation in the coming weeks and more information to come. Once you register, we'll reach out to you requesting some input on the Q&A session. So if you guys can join, that would be amazing. But we're going to wrap it up for today. Please also note once this session ends, a survey will pop up for you to share some feedback on today's webinar. And we hope you can share some comments, and we appreciate any responses that we receive. Your feedback is always appreciated. And as always, thanks again for joining. We look forward to seeing you in February for our next webinar, and have a great day. Thank you all.
Thank you.